I'm joined by Susan Rice, former National Security Advisor, former ambassador to the United Nations, and author of the New York Times bestseller, Tough Love. Ambassador Rice, nice to see you.
Good to be with you, Andy.
So 2 weeks ago, you wrote an op-ed piece in the New York Times that was critical of the federal government, saying that the government had failed when it comes to coronavirus. Do you still feel that way?
I do, Andy. I do. I'm afraid it's necessary to be frank about this. The New York Times actually in the last couple of days had a story that elaborated how a wasted month got us behind the curve and got us, in a position where we didn't have the tests, we didn't have the equipment. It's actually not a wasted month. It's a wasted 2 months, because it was actually early January when the Secretary of Health and Human Services was alerted by Chinese counterparts that an outbreak was underway in Wuhan. And from that moment, based on my experience as National Security Advisor, having worked the Ebola epidemic, Zika, having been part of the president's cabinet when we dealt with H1N1 swine flu in 2009, that's when all the gears should have started turning, because we have known for decades that a pandemic of global magnitude was imminent. In fact, we were overdue based on how frequently these things have happened in recent centuries. And therefore, we had put in place during the Obama administration a number of mechanisms, including an office that I established under my leadership at the NSC, an office on global health security and biodefense that was supposed to be the early warning mechanism for something like this. So as soon as that call came from China, we should have understood that in all likelihood, this was a disease with the potential to spread. And at that moment is when we should have begun working on putting in place the testing and having the testing capacity to spread across a nation rapidly. It's the point at which we should have alerted the states and local authorities to begin to prepare to ensure that they had adequate supplies of masks, of ventilators, of personal protective equipment. We know that our healthcare infrastructure has gaps, has weaknesses, and those gaps are particularly pronounced in a crisis. And so we had early warning. We didn't take advantage of that time to prepare optimally. And that's in large part why we're behind the curve now. We still, though testing is ramped up, of course, we don't have enough. There are plenty of people who still can't get tests. And we clearly don't have enough masks and ventilator and other protective gear to keep our healthcare workers and our first responders safe. And so that is a profound failing. And I think the reality is, Andy, that as a result, we will have more Americans die than would have needed to be the case. Our economy will take a harder hit and will take longer to recover than would have been the case had we been optimally prepared. And that's why at the end of the Obama administration, we left our colleagues in the incoming Trump administration with a 69-page playbook. Right. We ran an exercise with the entire incoming cabinet, and I certainly briefed my successor on what we had done and why to prepare for pandemics, because we recognized, as I wrote in my book, and Tough Love, and as I have said in any number of speeches, that this is a nightmare scenario.
Right. New York City, let's talk about that, because it has become the epicenter of this virus. Today, a Navy hospital ship, the USNS Comfort, has come to New York, bringing support to the city's struggling hospital infrastructure. Are we doing enough in New York City, and what else could we do there?
Well, I think Governor Cuomo has been a fabulous leader in a time of crisis. He's been very clear about what he and his experts estimate to be the needs in New York State for hospital beds, for healthcare workers, for ventilators and protective gear. And he is trying to beat the clock by building out, with federal support, the number of beds and the number of ventilated ICU units that are critical to be prepared for the surge, which he predicts could be, 140,000 uh, hospitalized patients at one time and requiring 30 to 40,000 ventilators. So he's doing his utmost, and I think he would be the first to say that he appreciates what federal support he's received, but it's not yet enough. Thankfully, we are now seeing the Army Corps of Engineers mobilized to help build additional facilities. That's something that's going to happen not just in New York City and the nearby areas, but around the country. We have capacities that we are still not employing. The president has the authority under the Defense Production Act, not just to tell GM to build some additional ventilators, but in fact to organize the entirety of the supply chain for ventilators and protective equipment, and to say to all of the suppliers, you've got to do X by Y time. And then the federal government, very importantly, needs to be in charge of the distribution of those new ventilators and those coming out of the stockpile. Because right now, as you've heard every governor, Democratic and Republican, say multiple times, they're competing against each other and against the federal government for the vital life-saving equipment they need. There's no reason that should be the case.
And finally, Ambassador Rice, President Trump has called this the Chinese virus. And you said that this is unnecessary, to put it mildly, and it demonizes foreigners. What do you mean by that precisely?
Well, he's called it the Chinese virus. He's called it the Wuhan flu, along with Secretary Pompeo. He said it's a foreign virus. And the fact of the matter is, Andy, that pandemics and viruses don't wear flags. They don't know national borders. They can arise anywhere and spread anywhere. So we've heard a lot in recent days about the Spanish flu of 1918. The evidence is that began in Kansas. We've heard a lot about the 2009 H1N1 swine flu pandemic. That too originated in North America, Mexico, and right thereafter the United States, and spread around the globe. So there's plenty to criticize the Chinese for in terms of their domestic handling of this. But to brand it with a racist, nationalistic tag and suggest that it's their fault that this arose and it's their responsibility to compensate the world, which is now sort of beginning to be the rhetoric, defies logic and defies history and is completely counterproductive. At the end of the day, by definition, a pandemic is a global phenomenon. We have to stamp it out, not just within our own shores, but in every part of the globe, because if we don't, it will come back and resurface and respan the globe. So it's not good enough to end it in China or end it in the United States. We've got to deal with it in places from Ethiopia to Burma, quite frankly. So it's just not rational. It's not productive. It's xenophobic. It's causing all kinds of reactions and hostility towards Asian Americans that dangerous and unfounded. And frankly, I hate to say it, Andy, but it's part of a pattern that this president has employed, demonizing groups of people who come from backgrounds of color, whether Muslim Americans or Mexican Americans or African Americans, now Asian Americans. And it's just divisive, counterproductive, and really not what we need and expect of our leadership at a time of crisis.
Just a quick last question, Ambassador Rice. When do you think this will end, in the United States at least?
I wish I knew exactly, Andy. I'm not a public health specialist. I'm not a doctor. I do have a lot of policy experience with this sort of thing. I expect that this level of lockdowns that certainly people in New York and now increasingly people in the Washington area are experiencing is going to be with us, not just for weeks, but potentially for a few months. And we also need to be prepared, as the experts say, for the potential that we have a slowdown in the spread of the virus, and then it comes back again with something of a vengeance in the fall and winter. And so the goal here has to be to try to accelerate the adoption of a viable vaccine, which I believe the federal authorities and Dr. Fauci and others are working very hard on, and at the same time to try to ramp up any available treatments, which won't stop the spread of the disease, but will potentially mitigate its severity. And then it's crucial that each and every one of us as Americans and people living in this country do their part to really adhere to the strict social distancing requirements. Stay at home, stay apart from each other when you have to go out for critical, supplies or medicines. Take this deadly seriously, because if you don't, more Americans will die, more healthcare workers will die. And, the president said blithely yesterday that if 100,000 Americans or 200,000 Americans were to die, he would count that as a success. I don't know under what definition of decency that could possibly constitute a success. But the good news, Andy, is to some extent, this is in our hands as Americans, as individuals, as citizens. We have the capacity to make this less bad than it would otherwise be if we take these dictates to stay home, avoid other people outside of your family unit, only go outside for the most necessary errands, and recognize that is the most important thing we can do to protect ourselves, protect our neighbors, protect the vulnerable, and save lives in the aggregate.
Susan Rice, former National Security Advisor, former ambassador to the United Nations, and author of the New York Times bestseller, Tough Love. Thank you so much for your time, Ambassador Rice.
Appreciate being with you.
Hey investors, Zach Guzman here. Are you interested in learning more about the markets and getting the latest financial news? Well, then click right here to subscribe to our Yahoo Finance YouTube channel. Get the latest up-to-the-minute market analysis, big interviews in the world of finance, and information on how to manage your money every day wherever you are.